All right, good morning, everyone, and you are warmly welcome to ChrisVee Medical Lecture. Today is also another day that God has made, and we won't take it for granted. And we thank God that all of us we are doing well, and we're going to learn as well. So today we're going to focus on the fields of anatomy and physiology, and specifically we want to consider the gastrointestinal system. And even under the gastrointestinal tract, we would also be considering another aspect, which is specifically on swallowing, or in a more scientific term, you want to say deglutition. So as far as ChrisVee Medical Lecture is concerned today, this is the area we are going to focus on. My name is Vincent Sabuaje, and I will be your facilitator at the Department of Physiology, MPhil, University of Ghana Medical School, Kolebu. I'm glad to be your host for today. So we want to set the ball rolling and we go straight to the point. Now, as part of my today's presentation outline, I'll be taking you through a whole overview of the gastrointestinal tract. And we also consider the phases of the GIT. The gastrointestinal tract is divided in different phases. So we'll be considering the phases as well. And then thirdly, we'll go to our main activity for today, which is deglutition, or in a more layman's point of view, you want to say swallowing. We're going to look at the basic anatomic and physiologic mechanism behind swallowing. And then after we are done, we will also consider some of the disorders of swallowing. And of course, so that is going to be our presentation for today. So of course, this is going to be the whole overview, and I believe that you're going to have time with me, and then we're going to go through this together. So we want to set the ball rolling. Don't forget, it's a ChrisVee Medical Lecture. I'll urge you that even as you are watching this video, don't forget to subscribe and then hit the bell button so that you can get any notification of our newly uploaded videos. So now we want to look at the whole overview of the gastrointestinal tract. Now, when we talk of the gastrointestinal tract, or better still, you want to say the digestive system. It's a system that is composed of a long muscular tube, which is called the GI tract, or you want to also call it the alimentary canal. So it is this long muscular tube which has a main organ, and also there's some other organs that plays kind of a way another role in it. However, they are not involved in it mainly. So we want to call them the accessory organs. So today I'll be taking you through the main organs and as well as the accessory organs. Yeah. So just as I said, if you want to consider the digestive system or the alimentary canal, or better still the GI tract, then we want to consider the main ones. After we are done with the main ones, then we go to the accessory. So now with the main ones, you can talk of the oral cavity, you can talk of the pharynx, the esophagus, you can also talk of the stomach, the small intestines, the large intestines, the rectum, and then the anal canal. So please kindly follow me with a diagram, and I will use the pointer to show you. Now, of course, when we are talking about the main one, we have the oral cavity, or better still, you want to say the buccal cavity, where food is being placed in the mouth for mastication to take place, grinding it, and then also for addition of salivation and stuff. After the oral cavity, food will now get into the pharyngeal phase. And then after the pharyngeal phase, it goes into the esophagus. So right from the esophagus, food will get into the stomach. From the stomach, it will get to the small intestines. So all these things that you are seeing are the small intestines. And then right from the small intestine, it joins it at the ileocecal region to join the large intestines. So all these parts you are seeing are the large intestines, and then you get to the rectum. So this, of course, is the main organs that are involved in the alimentary canal or the gastrointestinal tract. Now, aside this one, we also have other organs, even though they don't play a direct role in ensuring that digestion has taken place. However, they contribute to digestion taking place in the body. And so because of that, we want to call them the accessory organs. So of course, if you hear accessory organs of the GI tract, then we want to talk about organs that has some role to play. However, they are not directly involved in it. And these include the teeth, the tongue, the salivary glands. You can also talk of the pancreas, the liver, and the gallbladder. So just as I use a diagram to show to you, we also want to follow it diagrammatically. So of course, you may have your teeth obviously in your mouth, which is not shown here though. And then we have your salivary glands. They have a role to play in the digestion, and so we call it an accessory gland. We also have your tongue here. Now, there is a full lecture on the tongue and then the salivary gland. So you want to also hit on our YouTube page and then get these videos so that you can have an adequate knowledge on these aspects. So these are this thing. And then we also have the liver. The liver also has a role it plays in digestion. Of course, we have our gallbladder and then our pancreas. So all these structures are not directly involved in digestion. However, they have a role they play. We're going to have a section of these structures as far as ChrisVee Medical lecture is concerned. We're going to have a whole idea, an overview of all these structures and what they do as far as the gastrointestinal tract is concerned. So now, just as I said, we want to look at the digestive system. What is it? Now, when we talk of the digestive system, it is the digestive system is a system of, when we talk of the digestive system, is a system that breaks down food and supplies the body with water, nutrients, electrolytes that are needed to sustain life. So just as you are watching me today, the reason why you are strong enough and you are following what we are doing has to do with the fact that you are being supplied with the nutrients that you need, the water levels, and the electrolytes that are supposed to get into your body to sustain you. And so in one way or the other, you are getting all these things in the right proportion. And that is why you are strong enough, you are fit, and you are equally following this lecture. And this is what the digestive system does to us. So of course, you will also understand that if your digestive system is impaired, then nutrient absorption and then being taken into the cells is going to be impaired. And of course, it's going to be something else. You don't want to experience that. So this is the reason why you would want to know something small about your gastrointestinal tract so that at any particular point in time, you know how to deal with it. Now, this system that we are talking about is not just a system like that, but it employs a lot of coordinated muscle movement and secretions of substances to process food. Now, when I say this, you realize that as we are going forward, you realize that we are going to see a lot of muscle contraction and relaxation as far as food is concerned from one phase onto another. So when I talk of it employs coordinated muscle movement, that is what I mean. Of course, along the line too, you will also have seen that there will be a lot of secretions. For instance, in the mouth, there will be some saliva secretion, there will be some digestive enzyme secretion in the stomach and the rest. Now, along the line, you also see that there are a lot of cells that secrete certain hormones and substances, all in making sure that the food that you are taking in is kind of a way being processed. So that is the digestive system. So when I talk of food processing, I'm talking about the process by which you ingest food and digestion is being taking place. And after digestion, absorption also takes place so that the cells that are the basic structure and functional units of your life get the needed nutrient that they're supposed to get so that they can carry out their day-to-day activity. So this is a simple process. And for the next of our time, we're going to focus on how this is done. So you'd also realize that, so this of course is the overview of the digestive system. Just as I said, we have series of lectures. Don't forget that GIT is a structure that we can use one day to go. So we've broken it into modules, and at any particular point in time, I will be telling you the modules and how you can assess them. So this time we want to focus on the phases of the GIT, the phases of the GIT. It's just as I said from the beginning, it's a long muscular tube that involves a whole series of organs that have a role in making sure that the food that you ingest is being taken to the right place for absorption to take place. Of course, digestion coming in, and on the day, the ones that are not needed, you eliminate them as feces. So we're going to look at the process that is involved in this whole mechanism. At one point in time, you take in food, and then at another point in time, it comes as feces. What has happened to it? Follow me, and we'll take it gradually. So now, with the phases of the digestive system, you want to talk about ingestion. Now, when we talk of ingestion, we are talking about putting food in your mouth, and after put food in your mouth, you have to break down the food into smaller pieces in a process we call mastication. So we're going to take time and then consider this mastication process, and then also see what happens to it, and then what goes on as far as mastication is concerned. Now that is all these things are happening in the in the oral phase or the ingestion phase. And then as well as when we talk of the ingestion phase, we're also talking about after food has been masticated, it is being moistened with salivary secretions and other chemical digestive enzymes so that food can be processed further. We also talk of here, we are talking about the initiation of swallowing, which is deglutition. And of course, today's lecture, this is going to be our main focus. So this is just one phase of the GIT, the gastrointestinal tract, which is ingestion. Another phase has to do with what we call the digestion itself. And so it is because of this reason I wouldn't want to call it the digestive system, but I prefer the word the gastrointestinal tract. Because even though it is called digestive system, but digestion is just also one phase of the whole phases. So with digestion, we are talking about the process where food is being broken down into small particles in a way of grinding actions by the GI tract, and then it will be further be degraded by some digestive enzymes. So of course, along the line, you hear some digestive enzymes like lingual lipase, alpha amylase. You can also hear like proteases, lipases, pepsin, and the rest. They all come into action in making sure that the food that you have taken in at the end of the day is being broken down into smaller pieces. I mean, into absorbable forms, which will be utilized by the body. So, of course, this is what is mainly known as the digestion. So, you would also realize that at the end of the day, just as I said, you can have starch food that will be degraded by amylases into monosaccharides. You can also have proteins that will be degraded by proteases such as pepsin, trypsin, peptidases into dipeptides and amino acids. And then on the day, we also have some fatty food that will be degraded by enzymes like lipases and esterases into monosaccharides and then free fatty acids. So these are the digestive process. And just as I said, we have a whole lecture on this aspect. Digestion alone, you want to go and then have a view of it. Don't forget, it's a ChrisVee Medical lecture. It's a team that have deep dive into the fields of anatomy and physiology as well as medical microbiology to give you the best of it. So if only you have interest, then you're on the right platform. So this is the phase of digestion. And then at the end of the day, after these things have been further broken down into smaller pieces, and to the pieces that you prefer, at the end of the day, it needs to be absorbed. Don't forget, we don't need this in the stomach or we don't need this in the small intestine. That is not the final destination. As a matter of fact, it is your cells, which is the basic structural and functional units, that need these things so that they can use it to carry out their day-to-day activity. So all the nutrients that are found in the food that you are taking into your body needs to get into the cell. So at the end of the day, after it has been broken down, it has to be absorbed. That is what we call the absorption phase of the GIT. And it's very, very, very important. You don't want to overlook that one as well. So talking about the absorption phase, this is the phase where nutrients, water, and electrolytes are being transported from the GI tract. So specifically, absorption is taking place in the small intestines into circulation and into all the parts of the body where they are needed. So food will get into the stomach, it will be processed, and then there will be another process called segmentation in the small intestines where food will be in the absorbable forms, and then it will be absorbed into circulation. And then we have the whole overview. So just as I said, we have a whole lecture on the stomach and the small intestines as well as the large intestines. You don't want to overlook that one. You want to also view it and have a fair idea. In that video, we've talked about how vitamins are being absorbed, how water is being absorbed, how carbohydrates, monosaccharides, and the rest, how they are being absorbed, so that you have a fair overview of it. All right. So in that case, then we will now want to focus on what we call swallowing or deglutition. Swallowing or deglutition. Now I know by now you've taken in something and then you are thinking what went on in your mouth, what went on in the stomach, and I mean what happened inside of you. At a point in time, you'll be very, very hungry, and the only thing you need to resort to is to get food to eat. Now then you ask yourself, what goes on? What are the processes that takes place before the food can get into the cells? And that is what we want to take you through in the process called swallowing. So that is just a part of it. We focus on the part of it, and then you also want to look at the other videos to get a whole overview of it. So now when we talk of swallowing, we are talking about the process through which food is being we are talking about the process through which food is being breaking down. Food is being breaking down, being transported from your mouth through the pharynx into the esophagus, into the stomach. So swallowing, it's a mechanism, and of course, it should also go through a specific pathway. So the pathway is the process where food is being taken into your mouth. It will be transported from your mouth to the pharynx, and also from the pharynx to the specific and desired pathway, which is the esophagus, into the stomach. Now, when I talk of specific and desired pathway, I want to also let this be known that when you swallow food from the oral region and it gets to the pharyngeal phase, it is not always automatic that it has to go through the esophagus. There are other pathways that food can mistakenly enter into, and we would take time and look at all these other pathways. For instance, food is likely to take the pathway of the nasal cavity if care is not taken, and food is also likely to take the pathway of the trachea or the windpipe if care is not taken. So when we get there, we're going to take time and look at how the body is in reflex wise structured in such a way that food will not take any of this pathway, but however the desired one, which is the esophagus. So this is a whole overview of swallowing. So when I talk of normal deglutition, of course, we have a condition we call dysphagia. Dysphagia is difficulty in swallowing. Yes, so we have abnormal aspect and then we have the normal aspect. For now, I'm going to focus on the normal, and after I'm done, I'll take you through the abnormal aspect. So it's a complex and a series of voluntary and involuntary neuromuscular contractions. Just as I said, at the end of the day, you realize that when we talk of digestion, it's not just one thing just going through the fat simple like that. There will be a lot of contractions that will take place. At the end of the day, we'll get to where we want to get to. And that is this thing. Now, so because of this, swallowing or deglutition has been partitioned into three phases, into three distinct phases. So you realize that food at a particular point in time will be in one phase for a specific processing. When it is done with that phase, then it gets into another phase, then it gets into another phase, and then we are done with swallowing. So take time, follow me, and I'm going to take you through all these phases so that you have a fair idea of what swallowing is. So number one, we have the oral phase of swallowing, where food is being placed in your mouth for mastication process, for grinding process, and for mechanical and some sort of chemical digestion. Yes, of course. In a mechanical is where your teeth and tongue comes into all ensuring that the food is breaking down into smaller pieces. And then we also have some chemical chemical breakdown, such as salivation of these saliva on the food, as well as some lingual lipases coming in, and then alpha amylases. They are all chemical substances. So in the mouth, you can have some chemical role and then the mechanical role, all in ensuring that food is breaking down into the needed forms. So that is the oral phase for you. And then we have the pharyngeal phase. And then lastly, we have the esophageal phase. Now, when we are done with the esophageal phase and food gets into the stomach, then we say we are done with swallowing. So you can see, kindly follow me with this small diagram at the low bottom right. You realize that you have your, this is not that clear though, but at least we can use it. We have the oral phase, the oral cavity, and then when food leaves the oral cavity, it gets into the pharyngeal phase. And then after the pharyngeal phase, it gets into the esophageal phase. And this is the three distinct phases that for the next few minutes, we're going to dive into detail so that you have a fair idea of what it is to talk about the phases of swallowing. All right. So this time we're going to take the phases one after the other. Okay. So we now want to consider the oral phase. The oral phase. And the oral phase, before we also consider the oral phase, we want to look at one thing here. Now, when do we say that food is in the oral phase? And when do we say that food is no more in the oral phase? It means that you should know what we call the boundaries. Boundaries. So when food is found in between these two boundaries, then we can confidently say that food is in the oral phase. Now, the first boundary you want to consider is the first boundary you want to consider is what we call the oral vestibule. The oral vestibule. Now, the oral vestibule is the space between your lips and your teeth. That is the oral vestibule. So just as you are looking at the pointer, when food crosses this region, then it is said to be in the oral phase. Oral phase. So that is the first boundary. And then we have also another phase we call the palato-grossa arc. The palato-grossa arc. So you can see a fine arc here, which is the palato-grossa arc. Now, when food hits this region, then food is said to be no more in the oral phase. That is the palato-grossa arc. It is arc because it is geared in such a way that it prevents saliva from entering into the pharyngeal phase unless you are swallowing. So just as you are seated quiet, you are looking at me and you are not swallowing, the reason why saliva which is found in your mouth is not being found in the pharynx is that we have a structure we call the palato-grossa arc, which is in an arc shape, thereby preventing the involuntary movement of saliva into your pharynx. Of course, we don't want that to happen. So these are the two specific boundaries that are found with the oral phase, the oral vestibule, and then the palato-grossa arc. If food is found in between these two boundaries, then we are saying that food is in the oral phase. So now because of that, we've now seen the boundary. So we're going to take time and then look at what happens to food in between these two boundaries. And that is going to be our next lecture. So number one, you see, definitely when you're taking, for instance, you're taking in your ampesi, you're hungry, you're taking ampesi, definitely the ampesi has to be breaking down into smaller particles. Which structure is going to do that? Your teeth. But before your teeth can be grinding them, it has to be the movement of your mandibles. Your mandibles, kindly follow me with a pointer. Your mandibles have to be moving up and down, up and down. So that rhythmic up and down movement of the mandibles ensures that food is being grinded well mechanically by your teeth. Food is being grinded well mechanically by your teeth. And so because of that, we have muscles that are responsible for that. We have mandible depressing muscles as well as mandible elevated muscles. So in our lecture, we're going to focus on some of these muscles. So as part of the mandible depressing muscle, we have the lateral pterygoid muscles, We have the digastric muscles. We have the mylohyoid muscles. We also have the geniohyoid muscles. All these muscles are called mandible depressing muscles. In other words, these muscles ensures that the mandibles comes down, and then the elevating muscles will also come in to bring your mandibles up in the process of ensuring grinding. So, and then of course, we also have mandible elevating muscles where you can talk of the masseter muscle. You can also talk of the temporalis, and then of course the medial muscles. These and many other muscles ensures that your mandibles are moved up and down so that grinding process can be effectively be achieved. So this is more of the oral phase. So of course you can see our fine gentleman here. He has getting his food. You want to grind them, you want to eat it and get the best of it at all times. All right, so with the mandibles, after we are done with the mandibles trying to grind them and stuff, there are a lot of other processes that happens to the food. And that is where we want to consider. Don't forget, we are still in the oral phase. We are still in the oral phase. And this time we have a process we call mastication. So just as I said, as your teeth is grinding it, that is what we call mastication. And mastication is the mechanical breakdown of food into the smaller particles so that this time saliva and other digestive enzymes can have a way on it and then act upon it. So of course you realize that the food that you are swallowing, it starts being processed in the oral phase. That is where food will be breaking down, number one, and then salivation will also come in and other digestive enzymes. So you realize that at this particular point, food will be refined into a small particle called bolus. So at this particular time, we don't want to say that it is food. You want to say that it is called bolus. It is called bolus. And that is because it has been secreted, salivation has come in, and some digestive enzymes too has come in. So that is one aspect of what happens at the oral phase. At the oral phase. Please, I hope we are following. So we also want to consider another thing that happens. So because of this, at the end of the day, you realize that with the oral phase, the reason why we need to break down food is that we want lubrication to take place as well as food being softening so that it can go through the gastrointestinal tract without be, triggering any form of abrasions. Of course. So at the end of the day, saliva comes in. At the end of the day, digestive enzymes also comes in. Food is being moistened, it is being softened, it is well lubricated so that when it is going through the tract, it does not cause any harm. So of course, those of us who takes in, heavy, heavy size of ampesi and stuff, if you are to swallow what you took in into your mouth, then trust me, it is going to be another thing altogether. You won't even find it easy at all. But by the process of mastication, all these things are being ensured so that you don't find yourself wanting as far as eating and swallowing is concerned. So of course, we want to look at the role of the tongue. Yeah, definitely, the tongue has a role. Don't forget, we are still in the oral phase. The tongue has a role it plays as far as swallowing is concerned. Yeah. So the tongue, that I said earlier on, we have a whole video on the tongue and then the salivary glands. I said one video on its own, the roles that they play. So in this lecture, I'm just going to make mention of some few aspects of the tongue and what is that. And you realize that we have some muscles of the tongue. We have what we call the intrinsic muscles of the tongue, and we also have the extrinsic muscles of the tongue. And they all make sure that food is being processed well. The reason why the tongue has a much role to play has to do with the fact that we have what we call taste buds. So you see, the reason why you are taking in your food and you are enjoying the sweetness of the food has to do with the fact that these taste buds are found on the tongue. So if the tongue does not come in contact with food, then trust me, it seems to be like you will not feel the taste of the food. And I won't take you through deeper in the tongue, but we have different areas where these taste buds are located. We have taste bud for sweetness, taste bud for sour taste, for bitter taste, and the rest for meat taste and the rest. So let's look at particularly what the tongue does. We have first the intrinsic muscle of the tongue. The intrinsic muscle of the tongue creates something like a central trough so that if after you have masticated the food will be placed on the tongue so that this taste bud can be activated. And then we also have the extrinsic muscles of the tongue. Now, the extrinsic muscles of the tongue will also, at the end of the day, ensure that food is being elevated. So kindly look at it from the diagram here. Of course, you can't see the intrinsic and the extrinsic muscles, but at the end of the day, you can see their function. You realize that there is the creation of something like a central trough. So you see like a hole here where food will be placed in it on the tongue so that the taste buds and all that view can be activated depending on the type of food you are taking. For instance, if you are tasting sweet, then the taste buds are found just at the tip of the tongue. If it is a food that has a bitter taste, then you realize that the taste buds are found just at the posterior end of the tongue. And of course, if it is sour taste and stuff, some of them they are found at the edges of the tongue, literally. And then we also have the intrinsic muscle elevating the tongue. So you realize that all of them, the main reason is that it will lead to the creation of a downward slope. So the food will place on the tongue and your tongue will be elevated. So it will create a downward slope so that food can be moved posteriorly. What are we trying to do? We are saying that this time food is almost leaving the oral phase because the process that the oral phase will have to go through as far as digestion and then swallowing is concerned, is almost done. And so the tongue will help in moving the food from the oral phase into the pharyngeal phase. So just as I said right from the beginning, the moment the food hits the palatoglossal arc, then we can now say that food is no more in the oral phase. Food is no more in the oral phase. Or better still, I wouldn't want to say food, but I want to say then bolus is no more in the oral phase. So because of this, it brings us to the end of what happens at the oral phase of deglutition or oral phase of swallowing. And so because of that, we are now going to take time to focus on what happens at the pharyngeal phase so that we can equally have a fair idea of what happens at the pharyngeal phase. Don't forget, I told you that we have three distinct phases. We have the oral phase, we have the pharyngeal phase, and then we have the esophageal phase. And the moment the food leaves the esophagus and gets into the stomach, we are done with swallowing. So now, but you see, when food gets into the pharyngeal phase, a lot of things equally happens there. A lot of things equally happens there at the pharyngeal phase. Now, with the pharyngeal phase, we have a place where food can meet, where the mouth or the oral cavity meets the pharynx. So please kindly follow critically at the diagram and then you have a fair idea of it. So this is the oral phase. You see the oral phase and then the palatoglossal arc is found somewhere around this place. So this is your oral vestibule and then we have the palatoglossal arc. And from this place up to this place, we say food is in the oral phase. The moment food hits this region, it is no more said to be in the oral phase. However, it comes to what we call the pharyngeal phase. Now, with the pharyngeal phase, there are a lot of things. So we have a place where the oral cavity meets the pharyngeal phase or the pharyngeal cavity. It is called the oropharynx. So you see the name here, oropharynx. So whenever we talk of the oropharynx, we are talking about the phase where the oral cavity meets the pharyngeal cavity or the pharyngeal phase. That is the oropharynx. We also have another phase of the pharynx where the nasal, so this is the nasal part, so this is your nose and the pathway through which you breathe and stuff gets into. So we also have a place where the nasal cavity meets with the pharynx. and it is also called the nasopharynx. So just as the name, you could see the names with the color of the diagrams, nasopharynx. And then we also have a place where, so this is our trachea, and this is our esophagus. And then aside the trachea, we have the larynx. So we also have a place where the larynx meets with the pharynx. The larynx will meet with the pharynx. And so because of that, we call it laryngopharynx. Laryngopharynx. So you realize that because of this, a lot of things can happen when food gets into the pharyngeal phase. That should also tell you that the moment food gets into the pharyngeal phase, it is not automatic that food will definitely get into the esophagus, which is our desired pathway. The moment food gets into the pharyngeal phase, food is likely to enter any of these three pathways that I've made mention of. It's either food can go through your nasopharynx and get through your nose, or it's either food can get through your larynx and then get through the trachea, which is the windpipe, or food can get through the pharynx and then get into our desired pathway, which is the esophagus. So definitely, this is the desired mechanism that we want, which is the esophagus. However, just as I said, food can get into your nasal cavity. It can also get into your larynx, leading to the trachea, and food can get into the esophagus. So so all these things are happening at the pharyngeal phase. Don't forget the pharyngeal phase have not started yet. We've not made mention of what happens at the pharyngeal phase. I'm just introducing you to from the pharyngeal phase where food can get you. And these are the reasons why, in terms of courtesy wise, you need to, be concerned and focus when eating. You don't want to talk, you don't want to do any other thing, because food can be regurgitated into any of these pathways of which you don't want to experience, because it's a bad experience you don't want to encounter. So we're going to look at what happens in terms of reflex wise, so that the nasopharynx, the trachea, will be closed, so that food can be only be found in the esophageal, pathway, which is the desired one. Sorry, my video is breaking. I'm doing my best to rectify it, but it's kind of giving me some tough times. But I believe that is not distracting the lecture. All right. So in the first place, we want to consider what happens at the nasal phase, so that if you swallow food, the food will not come through your nose. Trust me, if you have ever experienced that before, it's a kind of experience you don't want to, kind of a way go through. So as far as the nasal cavity is concerned, we don't want food to go through the nasal cavity. So in the process of swallowing, this is what happens. First, there is a structure that is found here we call the uvula. It's quite unfortunate this picture is not giving a clear thing, but the uvula will such a way that it will be elevated. So the uvula is going to be elevated to close the pathway for the nasopharynx, number one. Please don't forget this is under, a whole lot of cranial nerve innervation, and you don't want to forget that one. We're going to take time to look into these innervations, but for the meantime, as a starter, you want to also consider that just place it at the back of your head that there's going to be the elevation of the uvula to close this pathway. Another day, there's also going to be the elevation of the soft pilot, all in making sure that this pathway is being closed. And so you see, because of this, definitely if this uvula and then the soft pilots are being elevated so that food will not get through your nasal cavity, that also means that when you breathe, you can't breathe, because the pathway through which air will pass through, so this is your nose, you breathe in and then air will pass through, that pathway has been seized. So of course we can now, uh, 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 um, we can now say that during pharyngeal phase of swallowing, breathing is ceased, what we call apnea. So because of that, we call it in a more scientific term, deglutition apnea. That is why it becomes very serious if food gets choked at this phase. If food chokes you, then it is going to be a serious threat, because at this phase, breathing is ceased. And you know the essence of breathing. Definitely, in one of our lectures, I'll be exposing you to the role of ventilation and how it is being affected if ventilation is being seized. And trust me, you don't want to have that encounter. So at this point, because of this, we will end up having a situation we call, deglutition apnea, and we don't want that to happen. So we are done with what happens at the pharyngeal phase in the process of closing the nasal cavity so that food will not end up in the nasal cavity and then will come through your nose. We don't want to experience that. And so because of that, so we are done with the nasal one. We also want to look at what happens so that food will not end up in your larynx and then get into your trachea. So here, three basic mechanisms happen, all in making sure that if you see the previous slide, kindly look at this place. You realize that this is the esophageal pathway and this is the trachea pathway. So at any particular point in time, you see that the esophageal pathway and then the trachea pathway, they are laterally arranged. They lie side by side. That should tell you that food, if you are swallowing food, instead of it going through the esophagus, it is likely to end up in the trachea, which is the windpipe. It is not the food pipe. It is the esophagus, which is the food pipe. The trachea is the windpipe. So we don't want food to get into the trachea. So because of that, what happens so that food will not be geared towards the trachea, however, it will get into our desired pathway, which is the esophagus. So in that case, just as I said, we have basically three mechanisms that happens. Number one, we have what we call the approximation of the vocal cords. The approximation of the vocal cords. Now with the vocal cords, this is what we mean. So please kindly, this time you want to follow me again and I'll take you through. Now when you take the trachea, we have a structure preceding the trachea, which is the larynx. Now the larynx, so please kindly follow with the diagram here. You realize that here is the larynx, and on the larynx we have a structure we call the vocal cords. So these are the vocal cords, and so we are the laryngeal region, the larynx region, and these are the vocal cords. So you realize that it is these vocal cords that right now as I'm speaking you can hear me, because these vocal cords, you want to call them the true vocal cords, they are beating and they are vibrating, and these are the ones that are generating the speech that you can hear me. So these true vocal cords are the ones that are responsible for speech generation. Of course, it's also under high cortical manipulations. However, basically, it is these true vocal cords that will beat and vibrate around even as I'm speaking to generate the speech that you can hear me. Now, with these vocal cords, you see that there are some pathway in it. So one of the ways through which it is being ensured that food will not end up in your trachea here is that there will be the approximation of the vocal cords. In other words, the diameter between these two vocal cords will be decreased, so that in all ensuring that the pathway through which food can get into your trachea and then into the windpipe will be decreased. So that is one of the mechanisms upon which, your body is adapted in terms of reflex wise to ensure that food does not get into your vocal cords. Sorry, your trachea. So that is number one. Number two, see this space that you are seeing here in between the vocal cords. This space that you are seeing here. This space that you are seeing here in between the vocal cords is what we call the glottis. The glottis. The glottis. So you realize that this is the glottis. So we want to also cover the glottis so that even if the approximation of the vocal cords is not really completely done, there may still be some spaces. There will be a structure that will cover the glottis so that if mistakenly food gets into the trachea, it won't still go into the windpipe. And so because of that, we also have another structure we call the epiglottis. So please kindly follow with the diagram and then you appreciate what I'm talking about. So this is the larynx leading to the trachea, and then we have the epiglottis. So because we have the space which is called the glottis, and even though if approximation of the vocal cord is not well achieved, then we want these epiglottis to also come and then cover the glottis so that there won't be any space at all. And so because of that, we call it the retroversion of the epiglottis. In a simple layman's term, we want to say that the epiglottis is now moving downwards. So it is retroverting to cover the glottis. So number one, I made mention of the approximation of the vocal cords, where the distance between the two vocal cords that is responsible for speech generation is being decreased so that the space for food to get into the trachea is also limited. Number two, if that is not well properly achieved, there will be the retroversion of the epiglottis to cover the glottis so that, food will not get in there. And number three, there is also the elevation of the larynx and up and anterior. This is straight under muscle contraction. So we have some muscles we call the circular muscles of the pharynx. They are going to contract, and when they contract, the pharynx, well, this is the pharynx, sorry, this is the pharynx, the trachea is going to move up and anteriorly. So kindly follow with the diagram. It moves up and anteriorly, in all ensuring that it is moved away from the esophagus. Now, the moment it is being moved away from the esophagus, then this time, to some extent, we are sure that food will not get into the trachea, because this time, even though per anatomical, anatomical observations, the trachea is close to the esophagus, but this time there have been some contraction that has moved the food, sort of the trachea, away from the esophagus. So three things happens for food not to enter into the trachea. Number one, approximation of vocal cords. Number two, retroversion of the epiglottis. Number three, elevation of the larynx up and anteriorly. All these mechanisms are there to ensure that food gets into the esophagus, which is our desired pathway. So I've made mention of what happens at the nasal cavity, which number one talks about the elevation of the uvula, number two, the elevation of the stop pilot, and then there are the trachea to have made mention of three mechanisms: approximation of vocal cords, retroversion of the epiglottis, number three, elevation of the larynx up and down. So because of this, now we want to consider what happens specifically at the pharyngeal phase. These are pathways that we don't want food to get to, and we're taking time to go through. So basically, we now want to look at what happens at the pharyngeal phase of deglutition or swallowing. Now, one thing that you don't need to forget is that the pharyngeal phase, although is the shortest of all the three phases of, as far as swallowing is concerned, however, it is the most complex phase of the swallowing phases. So you want to talk about the fact that it's the shortest but the most complex. It is most complex because at this phase there are a lot of innovations, and there are a lot of contractions that happens. I'm not going to take time to go through all those things. We have a separate lecture that talks about that. But basically, at the pharyngeal phase, there is a muscle we call the superior constrictor muscle. There is a superior constrictor muscle that will first contract so that we will have what we call pharyngeal peristalsis. Now, I will take time and take you through what is meant by peristalsis. So just as I said, at this phase of the swallowing, respiration is being ceased. And, because of the elevation of uh, 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 the uvula, and then the elevation of the soft palate, seizing the nasal cavity, at the same time, the retroversion of epiglottis, closing the larynx, and the approximation of the vocal cords. So even if you manage to breathe, it won't get to the desired destination. So of course, you want to also talk about that. And at this phase, respiration is being ceased. And that is what I said. It is called deglutition apnea. Apnea is your inability to breathe. And this inability to breathe is as a result of deglutition, or is as a result of swallowing. So we want to say it is called deglutition apnea. In respiratory terms, I'll be taking you through the other forms of breathing mechanism, where we have tachypnea, bradypnea, apneistic breathing, and the rest. And the normal breathing is what we call eupnea. Eupnea, EUPNEA. Yeah, eupnea. So this is basically some of the things that you want to consider as far as pharyngeal phase is concerned. So I made mention that we have pharyngeal phase, and then we have the so with the pharyngeal phase, just as I said, the superior constrictor muscles will contract. Now, the moment the superior constrictor muscles contract, then you realize that the and there will be the initiation of what we call peristalsis. Now, when I talk of peristalsis, I'm talking about the process by which, sorry, I'm coming, the process by which there will be the contraction and relaxation of the muscles of the pharynx, all in making sure that food is beat down the tract. So just as I said, we have basically the circular muscles, and then we have the longitudinal muscles, all in making sure that the food is being propelled downwards the tract. That is peristalsis. So peristaltic movement has to do with the coordination of these circular muscles and these longitudinal muscles, all in making sure that food gets down into the tract. That is peristalsis for you. Now, before we will say that food, so just as I said, it is the shortest of this phase, and the swallowing reflex here lasts for approximately 1 second. So you can just imagine you want to swallow between the oral phase and then the esophageal phase, which is the pharyngeal phase, is just 1 second. However, it is the most complex of it all. I don't know, but I think that God is very, very marvelous in dealing with some of these things. Yeah, of course. So yeah. Now, what is being characterized with the pharyngeal phase is that the moment food, so just as I said with the oral phase, that the moment food hits the palatoglossal arch, food is said no more to be in the oral phase. The same way, the moment food hits what we call the upper esophageal sphincter, I'll be taking time to take you through that when we get to the esophageal phase. But the moment food hits the upper esophageal sphincter, or bolus hits the upper esophageal sphincter, food is said to be no more in the pharyngeal phase. It is now in the esophageal phase. So of course, you also understand that we are about to begin the phase of the esophagus, which is the esophageal phase. Yes. Please, I hope it is clear. All right. So don't forget you're on ChrisVee Medical lecture, and don't forget to subscribe as well. So there is a whole overview of what I was talking about, food getting into the pharyngeal phase. And then there are some muscles here we call the upper esophageal sphincter. In a more anatomical terms, it is called the cricopharyngeus. The cricopharyngeus. Physiologically, we want to say upper esophageal sphincter, and that is because they are two. We have one sphincter that is located on top, and we have another sphincter that is located bottom. Basically, when we talk of a sphincter, we are talking about like something which is like a gateway that regulates the entry of substance. So for instance, if you want to talk about maybe a place, then you want to enter a place and you see that there will be a security man there. The security man determines who should enter the room and who shouldn't enter the room. So in this case, the security man is acting like a sphincter. So in any place that you find sphincter in the body, it tells you that that place is being regulated as to what should enter and what shouldn't enter. Yes. So that is sphincters for you. So just as I said, we are now, food has hit the upper esophageal sphincter or the cricopharyngeus. So at this point in time, food is said to be no more in the pharyngeal phase. So now we are getting to the esophageal phase. The esophageal phase. Now with the esophageal phase, food, just as I said, is being propelled down by the peristaltic wave mechanism that started in the pharyngeal phase. And this makes sure that food bolus is being propelled down. So esophagus is located or is isolated from the oral cavity by the or the pharyngeal phase by the upper esophageal sphincter, and also from the stomach by the lower esophageal sphincter. So I'll take you through in a more diagrammatic mechanism of these things that I'm talking about. So we have just what as I said, we have the primary esophageal peristalsis, which is being initiated by the swallowing, and then we have the secondary esophageal peristalsis, which is being initiated by the presence of food within the esophagus. Now, with the primary esophageal peristalsis, we are talking about the situation whereby food is being moved down. It is actually induced by swallowing. If you want to swallow something, then there will be reflex primary esophageal peristalsis, or in making sure that food will be beat down. But however, if this wave mechanism is not enough to propel food down, then there will be another form of peristalsis, which is called secondary esophageal peristalsis, to ensure that food is adequately being pressed down. Don't forget, this is different from what we call migrating myoelectric complex. I'll be taking you through that in the next season. But for now, let's limit ourselves to primary esophageal peristalsis, which is being initiated by swallowing, and secondary esophageal peristalsis, which is being initiated by the presence of food within the esophagus. All right. So now, if you care to know, this is the structure of the esophagus. So you realize that, so this is what I'm talking about, the upper esophageal sphincter. You see how it has been structured. It is contracting so that food does not get out and leave just like that. So just as I was saying, please kindly follow with the diagram. Just as I was saying, these are the sphincters that regulate what enters the esophagus and what should leave the esophagus. So just as I said, you have a building or a company or institution, you go, we have security men all over, making sure that they regulate who enters and who leaves. That is the function of the esophageal sphincters. And one thing that you also have to notice is that the upper esophageal sphincter is anatomical, and then the lower esophageal sphincter is physiological. Maybe at this point, you may really have a lot of these things, but as time goes, so you understand by what I say, anatomical upper esophageal sphincter and physiological lower esophageal sphincter. But in all, the basic idea is that when we talk of sphincters, they regulate the entry of substances. They, they regulate the entry of substances in there. So this is the esophagus. Now, so just as you can see here, this is what happens. Food, now the food bolus that was refined in the oral cavity, gone through the pharyngeal phase, is coming down. So this esophagus is made up of muscles. We have two kinds of muscles that are found here basically. We have the circular muscles, and then we have the longitudinal muscles. Of course, you can't see it clearly here, but these two types of muscles contract to ensure that food is being propelled down. Now, the circular muscles, what it does is that it contracts to decrease the diameter of the lumen so that the upper portion of it will contract and then push the food downwards. The upper portion will contract to push the food downwards, and then the longitudinal muscles will also contract to decrease the length of the tract of the esophagus, or in making sure that, so you see that, kindly follow with the diagram, the upper portion is contracting to decrease the lumen by means of the circular muscles, and then the longitudinal muscles are also contracting to decrease the length of the esophagus. And this is a mechanism through which, so as the upper portion is contracting and then the length is also decreasing, the food is coming down in that order. So this is what happens at the esophageal phase, the contraction of circular and longitudinal muscles, or in making sure that food gets down into our destination. Of course, so these are the regulatory mechanisms. So it is these sphincters that make sure that at the end of the day, food does not just come out anyhow. So this is the, so when it gets to, so when food gets into the lower esophageal sphincter, then the lower esophageal sphincter will also open, and then the moment this lower esophageal sphincter, which is also called the cardiac sphincter, which is also called the gastroesophageal sphincter, when it opens, then food will now get into the stomach. Now, the moment food lands into the stomach, we are done with swallowing. Swallowing is done. So we have three phases: the oral phase, pharyngeal phase, then the esophageal phase. And what happens distinctively at these phases is that at the oral phase, food is being masticated into smaller particles, and then it will be acted upon by saliva and other digestive enzymes like lingual lipase, alpha amylase. And when food gets into the pharyngeal phase, there will be the pharyngeal reflexes, or in making sure that the nasal cavity is being closed by the elevation of the uvula and then the elevation of the stop pilot. The trachea is also being closed by what we call the approximation of the vocal cords, number one, the retrovection of the epiglottis to cover the glottis, number two, and then the elevation of the trachea up and anteriorly from the esophagus, number three. So at the end of the day, you realize that food now gets into the desired part, which is the esophagus. And of course, the pharyngeal phase, the shortest of the phase, which lasts for approximately 1 second. Now, the moment food gets into or hits the upper esophageal sphincter, which is more anatomically called the cricopharyngeus, then food is said to be no more in the pharyngeal phase. And thus, we say that food is welcomed in the esophageal phase. And at the esophageal phase, there is a contraction and relaxation of these muscles of the esophagus, specifically the circular muscles and then the longitudinal muscles, all in making sure that food is being propelled downwards the tract. When it gets to the lower esophageal sphincter, it dilates or relaxes, and then food gets into the stomach, and we are done with swallowing. We are done with swallowing. So because of this, we now want to consider. So yes, so this is the the mechanism that happens there. So we now want to consider some of the disorders of swallowing. Disorders of swallowing. This thing that we are seeing, it seems to be like a simple mechanism in one way or the other. It's like a normal mechanism. However, it can be also characterized with abnormal things. And so we want to look at some of the abnormalities with respect to swallowing. Now, the first abnormality we want to talk about is what we call acid reflux, acid esophageal reflux, so now with the acid reflux, please kindly follow me here. Now you realize that, kindly follow with the diagram, you realize that this is the stomach content, this is the esophagus, and this is the lower esophageal sphincter. So kindly look at it well. This is the normal thing, the stomach content, the esophagus, and then the lower esophageal sphincter. Now, one thing that you don't have to forget is that, just as I said, we have a separate video on the stomach, the small, and then the large intestines, and you get to know what happens there. But just to say a few, in the stomach, we have what we call strong acidic content of the stomach at around a pH of 2, which is very, very acidic, and other gastric content. So at a point in time, if we are done with swallowing, we don't want any content of the stomach to come through the esophagus again. Other than that, it will cause what we call esophagitis. When we talk of esophagitis, we are talking about, in medicine or in biology, any word you hear ending with itis, that should tell you that we are talking about the inflammation of that thing. So when you hear esophagitis, we are talking about the inflammation of the esophageal tract. And that is because there has been the movement of stomach content or gastric content to the esophagus, which can cause this inflammation. And this thing is what we call heartburns. It is called heartburns because the esophagus lies close proximity to the heart. So it will appear as if it is your heart that is burning you, like there will be a burning sensation, as though it may look like your heart, but it's not the heart. So these are also one of the reasons why, if you are sick, you don't want to go to these over-the-counter medical sellers, because possibly, for instance, if you are a layman and this thing is happening to you, you may think that it is yes, it's your heart. You go and explain to them that my heart is doing me some way, and they will give you medication that has to do with the heart. Meanwhile, it has nothing to do with the heart. All right. So in this, and one of the mechanisms, what can lead to this situation is where the lower esophageal sphincter will fail to contract. Now, just as I said, I told you that when you talk of the lower esophageal sphincter and the upper esophageal sphincter, they are all the time contracting. They undergo what we call tonic contractions. Basically, as far as muscle contraction is concerned, we have two classes. We have what we call the tonic contraction, and we have what we call the phasic contraction. Now, with tonic contraction, it means that the muscle is continuously constricting or contracting unless otherwise presented with a stimulus for it to relax. So if there is no stimulus presented to the upper esophageal sphincter as well as the lower esophageal sphincter, then it is not going to relax. They undergo what we call tonic contraction. Now with the phasic contraction, we are talking about the rhythmic contraction followed by relaxation. So just as I told, the tract undergoes what we call phasic contraction. It contracts, it relaxes, it contracts, it relaxes, making sure food is being prepared down. But the sphincters are always tonically contracting unless food is being presented. So that is what's supposed to have happened in normal times. But in an abnormal situation, the lower esophageal sphincter fails to contract. And so because of that, if we have any increased pressure in the gastric content, then it can pull some of its content back into the esophagus. And we don't want that to happen. And this is basically what we call the acid reflux or esophageal reflux, which leads to what we call esophagitis and then heartburn. So this is, what it will cause heartburn and then esophagitis. And it is basically we talking about the fact that acid from the stomach erodes the esophageal lining. Now, another disorder I also want to talk about is what we call achalasia. Achalasia. Now, with achalasia, what we are trying to mean is that food is going through the esophagus by means of the rhythmic contraction and relaxation of the circular and then the longitudinal muscles. Now, when food gets into the upper esophageal sphincter to be down, under normal circumstance, if food should get into the lower esophageal sphincter, the lower esophageal sphincter is supposed to relax, just as we are seeing here, so that food can get into the stomach region. But in the case of achalasia, when food gets into the lower esophageal sphincter, the lower esophageal sphincter fails to relax, thereby preventing food bolus to enter into the stomach. And so because of that, food is being retained in the esophagus and it can't get into the stomach. And that is what we call achalasia. And so because of that, when that happens, at the end of the day, we are going to have food accumulating in the esophageal phase and as well dilating. So you can see this is a normal esophagus with the sphincter. But when the sphincter fails to relax, food is going to be accumulated here and it's going to dilate this. And it's very, very bad experience you want to, kind of undergo. So we have to find medical means to, dilate it for you so that food will not be retaining in the esophagus because it's going to be a bad experience you don't want to go through. And as far as our today's lecture is concerned, we're going to consider the last, aspect of the disorders related to, swallowing. And the last one I want to talk about is what we call belching. Belching. Now, with belching, for instance, if you're eating, the food can be accompanied with a lot of gases. Or when you drink a lot of gases like carbonated drinks and stuff, it is accompanied with a lot of gases. And so if care is not taken, there will be a build up of these gases in your stomach. But don't forget that in the process of swallowing, these sphincters are equally open. So there is an example of what I'm talking about. It's equally opened, and when there is the pressure buildup of these gases, the same way the food used can be the same way the gases also want to come out. So first, the gases can come out, and then when they come out, it comes with a form of sound. In those of us who are accounts in tree, we will call it say "ooh guso," yeah, that kind of sound, because the gases are coming out. Now it can become serious to the extent that it can even come along with some of the food. So I don't know if you have experienced this before, but there can be a time where you can, have this belching to the extent that you could feel that food is coming out of your esophagus. But on a day, you won't end up vomiting because the upper esophageal sphincter is still contracting. Don't forget I said they undergo tonic contraction. So unless being presented with a stimulus, it is always contracting. So sometimes you can belch and sense food coming out from your stomach through your esophagus, but it won't come out from your mouth because when it gets to the upper esophageal sphincter, it blocks it. And you see, it's a very, very serious thing. And that is what we call the esophageal regurgitation. And that is what we call belching. So, I mean, you also want to be sure of this food that you take in. You don't want to be talking whilst eating so that all these abnormalities cannot come in. Don't forget, we have dysphagia, just as I said earlier, or happens to be difficulty in swallowing. So these are many more what is being correlated to swallowing. So don't forget, it's a ChrisVee Medical lecture, and I would end here for today's lecture. Thank you very much for your audience. And if you are watching this video too on YouTube, you don't want to forget to subscribe, share, and then hit the like button as well as the bell button so that anytime we upload a new video, you have a fair idea of it. So let's sum up everything. We talk about the swallowing process today. We talk about the three phases: the oral phase, we talk about the pharyngeal phase, we talked about the esophageal phase, and we also talked about some abnormalities that are related to swallowing, which is number one, we talk about acid reflux. Number two, we talk about achalasia. Number three, we also talk about belching. Subscribe to our YouTube channel and you get more of these videos. Once again, my name is Vincent Abwaje and I'm your host for today. And I'm an MPhil student at the Department of Physiology, University of Ghana Medical School, Kolebu. And I'm glad I hosted you. Have a wonderful day.